Oral thrush, also known as oral candidiasis, is a fungal infection of the mouth caused primarily by the overgrowth of the yeast Candida albicans. Candida is a type of fungus naturally present in the human body, including the mouth, throat, digestive tract, and skin. Under normal circumstances, this fungus exists in balance with other microorganisms in the body. However, certain conditions can disrupt this balance, allowing Candida to multiply excessively, leading to infection. Oral thrush is more common in infants, older adults, and individuals with weakened immune systems, though it can affect people of all ages. Causes and risk factors. The main cause of oral thrush is Candida overgrowth. While the fungus is normally harmless, several factors can trigger its proliferation. Weakened immune system. People with compromised immunity, such as those with HIV/AIDS, cancer patients undergoing chemotherapy, or organ transplant recipients on immunosuppressive therapy, are more susceptible. Medications. Long-term use of antibiotics can disrupt the natural bacterial balance in the mouth, allowing Candida to thrive. Corticosteroids, especially inhaled forms used for asthma, may also increase the risk. Diabetes. High blood sugar levels can promote fungal growth, making individuals with uncontrolled diabetes more prone to oral thrush. Age. Infants and older adults are at higher risk due to immature or weakened immune defenses. Other conditions, dry mouth, xerostomia, poor oral hygiene, and denture use can create a favorable environment for Candida growth. Smoking also increases the likelihood of infection. Symptoms. Oral thrush presents with distinctive signs and symptoms, although severity can vary depending on the individual's health and the extent of the infection. White or creamy patches. The hallmark symptom is creamy, white lesions on the tongue, inner cheeks, roof of the mouth, gums, and sometimes the tonsils or throat. These patches may resemble cottage cheese. Redness and inflammation. The underlying tissue often appears red and may be painful or inflamed. Soreness and discomfort. Oral thrush can cause a burning sensation, difficulty swallowing, and a sore mouth. Cracking and redness at mouth corners, known as angular cheilitis. This symptom occurs when Candida infects the corners of the mouth. Loss of taste. Some patients report altered or reduced taste sensations. In severe cases, the infection can spread beyond the mouth to the esophagus, leading to esophageal candidiasis, which causes pain or difficulty swallowing and requires prompt medical attention. Diagnosis. Diagnosis of oral thrush is usually straightforward due to its characteristic appearance. A healthcare provider will examine the mouth and may gently scrape a small portion of the white patches to examine under a microscope. Laboratory tests, such as culture or PCR testing, may be conducted in uncertain or persistent cases to confirm the presence of Candida and identify the specific species involved. Treatment. The management of oral thrush depends on the severity and underlying cause of the infection. Treatment options include antifungal medications. These are the primary treatment and may be administered orally or topically. Common antifungal agents include nistidine, clotrimazole, and fluconazole. Mild cases may respond to topical antifungal lozenges or oral rinses, while severe cases often require systemic antifungal therapy. Addressing underlying causes, controlling diabetes, improving oral hygiene, adjusting medications that may contribute to the infection, and managing immune deficiencies are crucial to prevent recurrence. Home care measures. Maintaining good oral hygiene, rinsing the mouth with salt water, and limiting sugar intake can help reduce Candida overgrowth. For denture wearers, thorough cleaning and removing dentures at night are important preventive measures. Complications. Although oral thrush is typically not life-threatening, if left untreated, it can lead to complications. Spread of infection. In immunocompromised individuals, the fungus may enter the bloodstream and spread to other organs, causing systemic candidiasis, which is potentially life-threatening. Pain and nutritional issues. Severe oral thrush may make eating and drinking painful, leading to dehydration or malnutrition. Recurrent infections, without proper management, oral thrush can recur frequently, requiring ongoing monitoring and preventive care. Prevention. Preventive strategies focus on reducing risk factors and maintaining oral health. Practicing good oral hygiene, including regular brushing and flossing. Rinsing the mouth after using inhaled corticosteroids. Limiting sugar-rich diets, which promote fungal growth. Regularly cleaning and disinfecting dentures. Monitoring and managing underlying health conditions, such as diabetes. Conclusion. Oral thrush is a common but manageable fungal infection caused by Candida overgrowth. While it primarily affects infants, older adults, and immunocompromised individuals, anyone can develop it under favorable conditions. Early recognition, proper diagnosis, and effective antifungal treatment usually result in complete recovery. Addressing underlying health conditions and maintaining oral hygiene are key to preventing recurrence. Though often mild, oral thrush should not be ignored, as complications can arise, particularly in vulnerable populations. Awareness, timely treatment, and preventive measures ensure that oral thrush remains a controllable and non-threatening condition.